Sathyabama Institute of Science and Technology.
Hello all, welcome. This is VishnuPriya here, Assistant Professor, Sathyabama School of Physiotherapy, Sathyabama Institute of Science and Technology. This is my fifth lecture session on ligaments and muscles of vertebral column. This is the continuation of the previous lecture which we have discussed about the articulations of the vertebral column. In this lecture, I will be discussing about the ligaments, muscles, and finally we will have a summary. There are so many ligaments present throughout the entire vertebral column, and these are the ligaments which are very common in all these segments. So at first we have the anterior longitudinal ligament, posterior longitudinal ligament, intertransverse ligament, interspinous ligament, and ligamentum flavum. These are the common ligaments which are present throughout the vertebral column. So first we'll see about the anterior longitudinal ligament which runs along the entire anterior surface of the vertebral column from the cervical region to the sacrum, attaching to both the intervertebral disc and the vertebral bodies. The primary function of this ligament is to prevent hyperextension. So this is the anterior longitudinal ligament which runs from the cervical till the sacral region throughout the anterior segment. Next we will have the posterior longitudinal ligament. This posterior longitudinal ligament runs along the posterior surface of the vertebral bodies situated within the vertebral canal, and it prevents hyperflexion. So here we have a thick posterior longitudinal ligament which is present behind the vertebral body and within the vertebral canal. Next we have the intertransverse ligament. These ligaments run between and attach to the adjacent transverse process of each vertebra, preventing excessive lateral flexion. So here we have the intertransverse ligament which is attached to the transverse process of the adjacent vertebrae. Next we have interspinous ligament. These ligaments run between the spinous process of each vertebra, meeting the ligamentum flavum anteriorly and the supraspinous ligament posteriorly. So this interspinous ligament which is present in between the ligamentum flavum and the supraspinous ligament. These ligaments primarily prevent hyperflexion by stabilizing the spinous process of each vertebra. So here we have the interspinous ligament which is present between the ligamentum flavum and the supraspinous ligament. Next we will see about the ligamentum flavum, which is the most important ligament, also known as the yellow ligament or the golden ligament. This yellowish or the elastic ligament connects the lamina of the vertebra above and below via short pad ligaments. These short ligaments run from C2 to S1. So it is a very thick and strong ligament that limits excessive flexion of the vertebral column. It is one of the most important ligaments which is present at the posterior part of the vertebral bodies. Next we will see about the supraspinous ligament. This ligament attaches upon the tip of the spinous process of vertebra C7 to the sacrum, and anteriorly it meets the interspinous ligament that runs between the spinous process of each vertebra. It limits excessive flexion of the vertebral column. So this is the supraspinous ligament. Next we will move on to the ligaments pertaining to the segment. So first at the cervical region we have so many ligaments. The first ligament is the nuchal ligament, also known as ligamentum nuchae. Although the supraspinous ligament technically stops at C7, it continues till the external occipital protuberance. However, this section of external occipital protuberance is known as the ligamentum nuchae. This nuchal word, the term nuchae, refers to the nape of neck. So this ligament starts from the C7 vertebra and extends up to the external occipital protuberance. And this ligament plays a very important role in preventing hyperflexion of the neck. Next comes the alar ligament. There are two alar ligaments that attach the dens of the axis to the occipital condyle or the tubercles of the base of the skull. So, this blue colored structures are the alar ligament. This alar ligaments attaches to the dens of the axis to the occiput of the skull. Next we have the apical ligament. This apical ligament runs from the odontoid process of C2 and attaches to the edge of the foramen magnum, which is the largest opening of the occipital bone. So, this apical ligament runs from the odontoid process and extends to the foramen magnum. Next, we have the cruciate ligament, which is nothing but a cross-shaped structure which is running between the vertebral laminas. Next, we will move on to the ligaments which is present at the thoracic segment. First, we have the costotransverse ligament which connects the neck and the tubercle of the ribs to the transverse processes of the vertebra. A lumbocostal ligament runs from the transverse process of L1 and L2 and attaches to the last pair of the floating ribs, that is rib 12. So, here we have the costotransverse ligament which connects the ribs to the transverse process. Next, we have the radiate ligament of head of rib. The radiate ligament connects the anterior part of the rib's head with the intervertebral disc and the sides of the body of two adjacent vertebrae. So, this is the radiate ligament which is connecting the body of the vertebra to the head of the rib. Next, we have the intra-articular ligament of head of rib, which is nothing but it is the intra-articular disc. Next, we will move on to the ligaments pertaining to the lumbar region. First, we have iliolumbar ligament which attaches from the crest of the ilium and run to the transverse process of lumbar vertebra, which is the fifth lumbar vertebra. So, this ligament runs from the crest of the ilium to the fifth lumbar vertebra. Okay. Next, we will move on to the ligaments at sacral and coccygeal region. The first ligament which is present at the sacrum is the sacroiliac joint. These ligaments run from the sacrum to the ilium and they consist of anterior, posterior and interosseous ligaments. So, here we are seeing the posterior sacroiliac ligaments. Next, we have the sacrotuberous ligament which runs from the ischial tuberosity to the transverse tubercles of the sacrum. In this image, we could see the sacrotuberous ligament which is running from the ischial spine to the sacrum. Then we have the sacrospinous ligament. It attaches from the spine of ischium to the sacrum. Then we have the sacrococcygeal ligament. This ligament attached from the sacrum to the coccyx bone both anteriorly and posteriorly, and these are the sacrococcygeal ligaments. Next, we will move on to the next segment, muscles of the vertebral column. There are so many muscles which are attached to the entire vertebral column. It is broadly classified into extrinsic muscles and intrinsic muscles. So, under extrinsic muscle, it is further classified into superficial extrinsic and deep extrinsic muscle. Intrinsic muscles are further classified into superficial, intermediate and deep. First, we will see about the extrinsic muscles of the vertebral column. So, here we have so many extrinsic muscles. These extrinsic muscles are classified into superficial extrinsic and deep extrinsic muscle. Under superficial, we have two major muscles, trapezius and latissimus dorsi. Then under deep classification, we have levator scapulae, rhomboids major and minor. So, first, under the extrinsic muscle, we have trapezius, which is one of the biggest muscle. It is a broad, flat and triangular muscle. The muscle on each side form a trapezoid shape. It is the most superficial of all the back muscles. It originates from the skull nuchal ligament and spinous process from the C7 to T12. The fibers attaches to the clavicle, acromion and the scapula of spine. So this muscle originates from the nuchal line of the occipital protuberance and also from the C7 to T12 vertebra, and also it gets inserted over the clavicle, acromion and the spine of scapula. The action of trapezius is to elevate the scapula and to rotate during the shoulder girdle movement. It receives the nerve supply from the C3 to C4 spinal nerves. Next we have another big muscle called as latissimus dorsi. It is one of the biggest muscle. It originates from the lower part of the back where it covers a wide area. It has attachments from the T7 to T12 spinous process, iliac crest, thoracolumbar fascia and inferior 3 ribs. All the fibers converge into a tendon that attaches into the intertubercular sulcus of humerus. It receives the nerve supply from the thoracodorsal nerve. The major action of the latissimus dorsi is to extend, adduct and medially rotate the upper limb. Next we will move on to the another set of muscles called as rhomboids. So here we have two rhomboids major and rhomboids minor. These two muscles are present over the medial border of the scapula. So the first muscle, rhomboids major, originates from the spinous process of T2 to T5 vertebra, attaches to the medial border of the scapula between the scapula spine and the inferior angle. It receives the nerve supply through the dorsal scapular nerve, and the main action is the retraction and rotation of scapula. Next we have rhomboids minor. It originates from the spinous process of C7 to T1 vertebra. It attaches to the medial border of the scapula at the level of spine of scapula. It also receives the nerve supply from the same dorsal scapular nerve. The action is retraction and rotation of scapula. Next we have another muscle called as levator scapulae. It is a small strap-like muscle. It begins in the neck and descends down to attach to the scapula. It originates from the transverse process of C1 to C4 vertebra and attaches to the medial border of the scapula. So here we have the levator scapulae. The main action of the levator scapulae is to elevate the scapula. Next we will move on to the intrinsic muscles of the vertebral column. Here we have three layers of intrinsic muscles: the superficial layer, intermediate layer and deep layer. Under superficial layer we have splenius muscle, and in the intermediate layer we have the erector spinae, and in the deep layer we have semispinalis, multifidus and rotators. So first we will see about the superficial layer, which includes the splenius muscle, which has two muscles, splenius capitis and splenius cervicis. So first we have the splenius capitis. It originates from the C7 to T3 vertebra and also from the nuchal ligament. It gets inserted over the lateral superior nuchal line of the occipital bone, mastoid process of temporal bone, and it receives the nerve supply from the posterior rami of spinal nerve from C2 to C3, and the action is going to be the extension of neck, and also it helps in lateral flexion and rotation. The next muscle is the splenius cervicis. It originates from the spinous process of T3 to T6 vertebra and inserts into the C1 to C3 transverse process. So this muscle originates from the T3 to T6 vertebra and gets inserted to C1 to C3 vertebra. It receives the nerve supply from the lateral branch of posterior rami of lower cervical spinal nerve, and also it receives blood supply from vertebral, occipital, intercostal and deep cervical arteries. The action is lateral flexion and rotation of neck, and also it helps in extension of neck when it contracts bilaterally. Next we will move on to the intermediate layer of the intrinsic muscles. So here we have erector spinae, which is a very important muscle. which has three major muscles in it. The first is the iliocostalis, then we have the longissimus, then we have the spinalis. This erector spinae has three groups of deep muscles located on either side of the vertebral column. The function of erector spinae is to do extension of spine and lateral flexion of spine. So here we have the erector spinae, which has three major muscles which are situated bilaterally on parallel sides of the vertebra. Here we have a small mnemonic for erector spinae, I like standing, which stands for iliocostalis, longissimus and spinalis. Especially this erector spinae is responsible for erect standing posture. The first muscle of erector spinae is the iliocostalis. The iliocostalis muscle are the most lateral erector spinae muscle. According to their attachment and location, they are regionally divided into three groups from superior to inferior. So, this iliocostalis is being divided into three groups: iliocostalis colli, iliocostalis thoracis and iliocostalis lumborum. So, these are the three groups which is present from the cervical and at the lumbar region. So, the first muscle is the iliocostalis colli, originates from the angle of ribs 3 to 6 and inserts into the transverse process of vertebra C4 to C6. Then we have iliocostalis thoracis, which arises from the angles of ribs from T7 to T12 and attaches to the angles of rib from 1 to 6 and transverse process of C7 vertebra. Then we have iliocostalis lumborum, which originates from 3 points, especially from the lateral crest of sacrum, medial crest of iliac crest and thoracolumbar fascia. It attaches to the angle of ribs from 5 to 12, transverse process of vertebra from L1 to L4 and adjacent thoracolumbar fascia. Next we have another muscle called as longissimus. This longissimus muscle are the central erector spinae muscle. They are also the thickest and the longest muscle. These muscles include three divisions: longissimus capitis, longissimus colli and longissimus thoracis. Longissimus capitis muscle originates from the transverse process of vertebra from C4 to T5 and inserts into the mastoid process of temporal bone. Then we have longissimus colli, which extends between the transverse process of vertebra from T1 to T5 and transverse process of vertebra from C2 to C6. Then we have another segment which is the longissimus thoracis muscle, consists of both thoracic and lumbar part. The thoracic part travels from L1 to L5 vertebra, sacrum and posterior iliac crest until the thoracic vertebra and inferior 6 ribs. Then the lumbar part extends between the region surrounding the anteromedial aspect of ilium and L1 to L5 vertebra. The function of this longissimus muscle is to extend and laterally flex the spine. The longissimus capitis also helps in rotation of the head. So next we have the spinalis muscle. This spinalis is the most medial erector spinae muscle. They are divided into three regions, same as the previous muscle: spinalis capitis, spinalis colli and spinalis thoracis. The spinalis capitis originates from the spinous process of C7 to T1 vertebra and inserts into the midline of the occipital bone. Then we have the spinalis colli, which originates from the nuchal ligament and inserts into the spinous process of C2 to C4 vertebra. Then we have spinalis thoracis, which extends from the spinous process of T12 to L2 vertebra until the spinous process of T2 to T8 vertebra. The function of this spinalis muscle is to extend and laterally flex the cervical spine and also the thoracic spine. Next we will move on to the deep layer of the intrinsic muscles. Here we have semispinalis, multifidus and rotators. First, we'll see about the semispinalis capitis. The origin is from the articular process of the vertebra from C4 to C7 and transverse process of vertebra from T1 to T6. Then the muscle gets inserted between the superior and inferior nuchal lines of the occipital bone. So, this muscle originates from the T6 to T1 and then from C7 to C4 and gets inserted over the superior occipital protuberance. Action of this muscle is to extension and lateral flexion of the head. It receives the nerve supply from the greater occipital nerve, which is C2, and spinal nerve, which is C3, and it receives the blood supply from occipital artery. Then we have the multifidus muscle. This multifidus has three divisions. First, multifidus cervicis, multifidus thoracis, and multifidus lumborum. The multifidus cervicis arises from the superior articular process of the vertebra from C4 to C7. Then multifidus thoracis originates from the transverse process of entire thoracic vertebra. Then the multifidus lumborum originates from the mammillary processes of lumbar vertebra, posterior aspect of sacrum, posterior superior iliac spine of ilium, and posterior sacroiliac ligament. It gets inserted over the lateral aspect and the tips of the spinous process of the vertebra, which is 2 to 5 levels above the origin. Innervation is from the medial branches of posterior rami of spinal nerve. Blood supply is from the vertebral artery, deep cervical artery, occipital artery, posterior intercostal arteries, subcostal artery, lumbar arteries, and lateral sacral arteries. The action of multifidus is to do extension of spine and lateral flexion of spine and also rotation of spine. Next, we have the last muscle, rotatus brevis and rotatus longi. Rotatus brevis originates from the transverse process of vertebra from T2 to T12 and rotatus longi originates from the transverse process of thoracic vertebra. It gets inserted over the lamina or the spinous process of vertebra, which is one level above the origin, and the rotatus longi gets inserted over the lamina or spinous process, which is 2 levels above the origin. Then we receive the nerve supply from the medial branches of posterior rami of spinal nerve and the blood supply from the dorsal branches of posterior intercostal and the lumbar arteries. Action of the rotators are, obviously it is going to rotate and extend the thoracic spine. So, on summary, we have discussed about various ligaments which is present throughout the entire vertebral column, and also we have discussed the different muscle groups which is present superficial and deep. Thank you for watching.